So how is a diagnosis of autism made? Well, if you remember, there's three basic diagnostic criteria defined in the DSM-4, the Diagnostic and Statistical Manual, where we look at the quality of the communication, quality of social interactions, and having restricted interests or repetitive behaviors. There's 6 different criteria spread between these three categories, and this emphasizes the point that autism is a clinical diagnosis. It's how the behaviors that you see in a child to help make the diagnosis. There's no medical tests, there's no blood tests. For some of the autism mimicking conditions, we might want to do certain tests. But the important thing is that an early diagnosis is made. And there's a few different diagnostic and screening tools, which I'll mention here in just a minute. For pediatricians and even for parents watching this, there are some absolute reasons for referral that hopefully your pediatrician and other pediatricians are aware of. And that is a child who doesn't babble or coo by 12 months old. No gesturing or pointing. That can include a waving bye-bye, passive pointing using a parent's hand to reach by 12 months old. No single words by 16 months old. No 2-word phrases by 24 months old. And then any loss of language or regression in that area at any time. So early screening. And this has been something that the American Academy of Pediatrics and even in my local community I've been working on, is encouraging pediatricians at the 18-month well child check to provide a screening tool for parents. It's a simple questionnaire that can be done usually in 3 or 4 minutes and just takes a minute or two for the pediatrician or primary care doctor to grade. The one which I normally recommend is the modified checklist for autism in toddlers. It's a 23-question yes or no questionnaire, like I said, very easy to complete with pretty good sensitivity and specificity for autism. And then another one that's commonly used is the ASQ, or the Autism Screening Questionnaire. These are screening tools for which the pediatrician or primary care doctor might look at and consider referral to a specialist. To make a diagnosis, you can just use strict DSM-4 criteria. In my office, I use something called the Childhood Autism Rating Scale. This is a 15-question rating scale, 15-item. It's not questions, it's 15-item. It's an observational rating scale that I use in the office, scored on a scale of 1 to 4. And importantly, this is truly an observational test. I've had some families come in and say, oh, my psychologist or someone gave me this form to fill out and my child doesn't have autism. It's not the appropriate way to use a childhood autism rating scale. It truly is an observational test. The Autism Diagnostic Observation Schedule, known as an ADOS, is more of a research tool. It's a bit more cumbersome and requires extensive training. It's a longer test, although it's used by some neurologists in clarifying and autism diagnosis. And finally, just examiner's best estimate. Those of us who have been doing this for many years and do this day in and day out, we'll often spend half an hour, 45 minutes with a family, and maybe another 20 minutes, half an hour with the child, and just within a period of an hour or so be able to come up with a diagnosis that you might just call the examiner's best estimate. In the next section, we'll be talking a little bit about the causes for autism. Again, this is a controversial subject, so hopefully the information here will help clarify some of the questions that you have.